Now, in this video, I'm going to be giving you 5 reasons why you feel pain during your periods or during your flow. Welcome to this platform. My name is Haman. If you're a new member, follow us, subscribe to our YouTube channel, follow us on TikTok, Instagram, Twitter, and on Facebook. Number one reason why you feel pain during your periods is your body. Your body itself. Now this looks funny, but here I am meaning your body itself produces chemicals. And one of these chemicals is the chemical which causes pain. This chemical is called prostaglandin. When that chemical is produced in your body, it's the one that rushes to the site where a problem is. For example, if they have pinched you or you have stepped on a nail, those chemicals rush to that particular site. When they reach there, they send information to your brain, and your brain interprets the information and says, oh, there is some problem somewhere, and this problem is there is a nail there, and that's why you are feeling pain. So these chemicals here, prostaglandins, they are the number one reason why you feel pain during your periods. Another reason is that these chemicals themselves, they now cause contraction of your uterus. When your uterus contracts, it forces out the blood out of your body, out of your uterus, through the vaginal canal. So when this contraction keeps on over and over again, these prostaglandins also act because there is pressure there, there is a problem there. So pain will be felt in that area of contraction. Problem number 2, reason number 2 why you feel pain during your periods is that you may have big clots. Remember, when your body or when your uterus is trying to prepare for implantation or for the baby who is soon coming, and it produces very many nutrients, blood, and all that. So when implantation doesn't occur, your endometrium or your lines of your walls of your uterus, which have been built and prepared for that baby, they break down. Now when they break down, they can now break down into big particles. Sometimes they break down into small particles, but now if it so happens that they break down into bigger particles, you will find that these particles will have a problem passing through your uterus down to the cervix and down to the vaginal canal. So when they force themselves out, then you feel pain, which is also connected to the prostaglandins. As I've told you, it's the number one reason. Reason number 3 why you feel pain is when you have a narrow cervix. Because some people, especially people who have just started their menses, you might have a small cervix. And when you have a small cervix, even those people who have never actually produced, maybe, they might have a small cervix. So when that cervix is small and your clots are big, they cause pain because they are forcing themselves out of that narrow cervix. The another reason why you may feel pain during your flow is when your uterus is maybe in a bad position. If your uterus is in a bad position or a wrong position, it can also cause pain because as it is contracting and forcing the blood out, it is also squeezing through something which is not meant to be in that position. So the problem is the positioning of the uterus. If the uterus is positioned wrongly, my friend, you might have pain during your periods. However, this does not always occur, so it should not scare you. The information we give here is just educational. It is not to scare people. Okay? So if I say it doesn't mean that if you have pain, your uterus is misplaced or it is in another position or a bad position. Not at all. Reason number 5 why you feel pain during your periods is that you might have anxiety. What do we mean by anxiety? When you have worries, fears, you always fear, you always worry about that and that, uh, and it's associated by things like increase in high blood pressure, increase in breathing, your breathing rate increases, you can oversweat, something happens, something small happens, and you feel like you just want to burst out. That's anxiety, and it's a major it is a major problem actually these days with itself, and depression are a major problem these days actually, even here in Africa, because of very many factors. Yeah, so you should also take note of that. So if you're anxious, you're always anxious, you always worry about that and that, there is a high chance that you have your periods painful. So you can always do very many things to calm down your anxiety, and I'll be talking about those ones in another video. But I've also written a book, and this book here, it's called Stress Management. It's both on Amazon and Facebook, and even if you contact me, I can also give you the book in soft copy or hard copy, wherever you wish. So that book helps you. I've talked about how you can manage stress, how you can manage depression, and how you can manage anxiety, and how you can uh, avoid those bad emotional symptoms. So if you have anxiety, take care. It might lead to uh, period pains. By the way, it is a serious problem. Don't just leave it the way I've said it. Handle it with care. Take caution. Okay? So this other reason, the last reason, it's not among the the 5 reasons, but I've just brought it as a bonus in this video. If you have pelvic abnormalities, the pelvic region? The pelvic region is the region of your waist, yeah, which has your genitals, which has your vagina, your anus, and it's the pelvic region. So if your pelvic region, especially the female reproductive system, has a problem, for example, a chronic disease, maybe there is a tumor, maybe there is any problem, maybe mispositioning, you might have pain during your flow. And these problems can be, maybe if these cells that make the nutrients of your uterus to prepare for your baby, if they are misplaced and they go somewhere else, maybe through your fallopian tubes, then you might have pain. Also, if the cells, if the glands that also produce these chemicals also overgrow, if they overgrow in your uterus, it can also lead to that pain. Also, if you have diseases like diseases that affect both your urinary system and your female reproductive system, those diseases can also cause pain during your periods. Also, if these people who go and they implant for birth control methods like intrauterine devices, yeah, don't worry about my pronunciation. Those people are also at a high risk, especially the intrauterine devices that are made up of copper specifically. I'm not against anything here. We are getting information that have been researched. So these intrauterine devices that are made up of copper, if you are using those ones, there is a high chance that you are having period, that you'll be having pains during your periods. So this information I give on this platform, use it well. Don't panic. Don't hesitate to visit your doctor. If I say something here, it doesn't mean that it's final. No. I am giving medical advice. And the last thing I'll always tell you is that whenever anything goes wrong, if you feel too much pain, for example, go and see your doctor. Okay, your doctor will give you much more information about your body, and he will even lead you to better medical advisors. Thank you. God bless you.